Hi, my name is Dr. Craig Klugman, and I am an Associate Professor and Assistant Director of the Center for Medical Humanities and Ethics at the University of Texas Health Science Center in San Antonio. And I'm here today to talk to you about advanced care planning. Advanced care planning is a process of figuring out what you would want at the end of your life. What sort of decisions might have to be made? What sort of messages would you want to leave to your family? We often don't think about it. We are a society and a culture that sort of puts the idea of talking about death on the back burner. In fact, it's something that we tend not to like to do. So advanced care planning is sort of looking it in the face and saying, you know, when my time comes, what do I want to have available? I like to think of this as a gift to your family, to let them know your wishes, what you would want, what you would not want. And it lets them, in a time of crisis and stress, know that they're making the choices that would have pleased you. So advanced care planning is an important step in your estate planning, in having your family conversations. The important thing about this is to have conversations, to make sure that those who are your friends and your family members know your desires and your wishes. So all the information that I'm going to present to you is about making these plans and helping you to have good conversations. What are the kinds of things you might want to think about when you're doing this kind of planning? Well, we have things called ethical wills, which I will go over in a minute. We have advanced directives, which I'll also discuss in a minute, but these are also available on another lesson. And an advanced directive in the state of Texas and in most states is composed of many different pieces. The first piece would be what's often called the living will, or the directive to physician and family. And this is when you're saying what medical treatment you would and would not want. The second piece is medical power of attorney, some places called the durable power of attorney, the surrogate, or the proxy. And this is the person who will be making decisions for you when you are no longer able to make them. The third is the out-of-hospital DNR, and most states do have this. And this is ensuring that you do not get resuscitation or other treatments that you might not want in the event that the ambulance is called or you're in an emergency room. And the last is probably a uniquely Texas thing, which is a directive for mental health treatment. And this is probably filled out by very, very few people, but it's those people who, if they were involuntarily committed, that what they would want and not want as far as their treatment goes. So it's probably the least common and the least used of all of these. You might want to think about such things as organ or body donation, and we'll talk a bit about that later. Some people like to write letters to their friends and family to say those things that you may not have been able to say now, which is part of having the conversations, is saying what you can. But sometimes a letter for your hopes, for their future, for the things that you want to say are very important. Making funeral arrangements. We don't like to think about the end and where we might be, but this is an important part of the process of planning for advanced care planning. There are many options that exist today, including burial, cremation, green burial, where your body is placed into the ground in a park, and there are many of these parks around the country, without a box, without a coffin at all, and you are just put into a park and allowed to feed the flora and fauna that grow out of the park. There are other cultures that do many other things. There are some new things such as having your ashes blasted into space, having your ashes made part of a barrier reef, and composting seems to be one of the latest ones and is very popular, well, as popular as that will be, up in Scandinavia. So there are issues to think about when you're dealing with your funeral arrangements. This is also less expensive the sooner you do it rather than leaving it for the last minute. So if you can plan in advance, you actually are saving your friends and family member not only the time and the hassle and the stress, but money as well. So it's something to think about when you are doing your advanced care planning. Another piece is your financial planning, putting your estate into order. You probably want to complete a last will and testament. If you have specific goods or materials that you want certain people to have, making that noted. If you want to leave money to charity, have that noted. Sort of where do you want your possessions, the things that you have collected throughout your life, to go? You will need an attorney for that aspect of this advanced care planning. The rest of this can be done with the advice of an attorney, but it doesn't require an attorney, but this piece does. There are software programs that you can buy as well, which will help you through that process, but I really advise that you consult an attorney for this process to make sure that the estate you create really follows the rules of the federal and state governments. And the last piece, which is also the most important piece, is to have the conversation with your family and your friends. We tend to neglect this. As I said, we as a society does not really discuss death. We don't discuss mourning. But if we could break through that barrier and actually have these meaningful conversations, not only will it make planning for the end a much better and easier process, but it will enrich the relationships that you will have in the time that you are still here on earth. The ethical will is a very new thing and a very old thing. So the concept of the ethical will actually comes out of the medieval Jewish tradition. And one of the first examples of the ethical will comes from Genesis, where Jacob is on his deathbed and he's surrounded by all of his children, who then become the 12 tribes, and he tells them what he thinks of them, what their character is, and what their hopes and wishes are for the future. And in the biblical story, what he's doing is he's describing the characteristics of the different tribes and their different roles in the society. So the idea here is that you are leaving messages about who you were, about what was important to you, letting future generations know, I was here and this is what I was about. This is what's important to me. This is who my life was, my value, maybe leaving some stories, your wishes for your family members, your concerns for them. Not everything Jacob said was very positive. Sometimes it was, I hope you get your act together. And your dreams. What are your dreams for your family, for the future, for humanity? So this is just sort of a letter that you would write informally, either by hand or on the computer, and you want to leave it where people would discover it. You can leave this with your other estate documents that people will discover this after you have passed. The other benefit of this process is it helps you to learn a little bit about yourself, about what you think is important. What has your life been about? So a big part of the process of grieving for ourselves and for others whom we have lost is making meaning. And this really helps with that process. So what kinds of things might you put into your ethical will? Well, firstly, you probably want to say something about your beliefs and values. What was important to you? What do you think the world was about? How do you think people should treat each other? What is the most important thing in your mind? Is it that you worked too much, or you didn't work enough, or you didn't spend enough time with your family, or you want there to be more love in the world? Let people know what your values are. Your spiritual values. What are your beliefs regarding life after death, regarding why we exist on the planet? What are your spiritual beliefs? Your hopes for future generations, the ones you know and the ones that you will never know. Any lessons that you learned from your life, from the School of Hard Knocks, or little tricks that you've used to help you get along through life very helpfully. It's always a good idea to mention your love for others, although, if you have these conversations, you should be letting people know how you really feel about them. You can kind of guarantee yourself a little extra comfort by knowing that it was in your ethical will. Forgiveness is also a big part of an ethical will. It's asking for forgiveness for yourself as well as giving forgiveness for others. This is, again, your legacy, and many people want to put forgiveness in as a big component of it. And then sharing any poignant memories, things that were important to you, times you spent with your family, influential moments in your life. And these documents don't need to be long. They don't need to be your entire biography. They're often short, a few paragraphs, a few pages, but just kind of letting future generations who may or may not know you have an idea of what was important to you in your life. And so the concept of the ethical will is actually becoming much more popular in the United States. There are books written on it. There are actually websites that you can visit that will tell you more about them and give you examples. Organ and body donation. Although, again, because we don't necessarily like to talk about death, one of the aspects of planning for it is the idea of, do you want to donate your organs or your body? In most states, there is a database, in fact, in over 40 states, that you can register to have your organs donated on. And it's also federal law that if you are a potential organ donor, that somebody comes and talks to your family about this. about the potential for donating for organs. But you can go to your state's website. In Texas, we have donatelifetexas.org. And this website will allow you to register what you want. The old putting the symbol on the driver's license still exists in some states, but not in all states. So the new website registries has actually become the new standard for how we make these wishes known. Some states will make it binding that if you do decide to donate your organs and you are a potential organ donor when you are at the end of your life, they're required to follow your wishes, whatever your family says, and other states do not, that they will follow the family's wishes. So again, register, make sure that people know what you want, but also make sure you have the conversation with your family and friends because they would have the ultimate say. Another option to consider is willed body donation. Most medical schools will have programs where you can will your body to science. And these bodies can be used for teaching the next generation of medical students, nurses, physician's assistants, as well as helping physicians to hone their skills. They'll be used for research into new diseases and new techniques. And if you contact your local medical school, if this is something that interests you, they can make it available. People who have done this program, their families find it very appreciative. They're very respectful. The students are taught about that this is a life and to respect the body. And one of the advantages is that usually they provide a disposal of remains, so often cremation is most common, and there will be a ceremony. And it's really a good way to give something back to science and medicine and to help other people into the future. So that's another possibility to consider when you're thinking about your advanced care planning. The advanced directive is probably the most commonly talked about piece of advanced care planning because it's the one that is going to affect you most directly when you are alive, when you are facing your final days. There is a federal law called EMTALA, and it requires that all federally funded healthcare institutions ask their patients about their advanced directives. So any institution that receives federal funding, so if they get Medicare dollars, if they receive grants from the federal government, they have to ask you upon admission, do you have an advanced directive? If you do not, then they are required to provide you with educational materials. Oftentimes those aren't available, but if you ask them for it, they can make it available. The time when you're admitted to the hospital is not the best time to be thinking about these sorts of plans. You should be doing this when you are ideally healthy, when you are in a place where you can talk about these issues and think about them rather than just trying to put it together very quickly. Just about every state has an advanced directive statute. There is one or two exceptions to this. And you really should have an advanced directive for the state in which you reside. Just about every state will recognize an advanced directive from another state, so if you go traveling within the United States, they will recognize and cover it, and it's probably one of the documents you want to take with you when you do travel. But you really should have one for the state of your residency to make sure that you're following all the laws and guidelines that they require for your state. And again, among these pieces is the directive to the physician and family, which in some places is known as the living will. And this comes into effect, at least in Texas, when you have a terminal illness or an irreversible condition and you're lacking competency. That is, you can no longer make and communicate your well-reasoned choices to someone else. If both of those categories are met, criterion are met, then the advanced directive comes in. But if you're able to speak, if you're not in a dying, if you're don't have a terminal condition or irreversible illness, then this actually does not come into effect. So it's kind of a narrow category of possible ways to die that this will actually come into effect. But it's better to have it than to not. As I said, I look at this as a gift to your friends and family because in a time of stress and a time of sorrow, it helps them make decisions. As an ethics consultant, I have seen many families torn apart trying to figure out what would Grandma want, what would Uncle Joe want, trying to figure it out. And often it splits the family and they don't speak for years because they have different ideas of what people would want. So you are helping your family stay together, to be coherent, to lose any sense of guilt they might have over whether this is what you wanted or not. And it lets you have some control over what you want and do not want as far as medical treatment at the end of your life. You must be competent and capacitated in order to create one of these documents. What that means is that you need to be able to understand information, to reason information, to explain information and decisions, and other people need to agree that you have this capacity. So again, this is not the kind of thing you want to do when you are in the final stages of dying, when you are sick, if you are already in later stages of dementia. This is something you need to do when you are in a good place. However, if you should change your mind, the competent and capacitated requirements don't exist for waiving your advance directive. So if you want to later disregard it, if you want to tear it up, no, you do not have to be able to offer a reason. You do not have to be able to have be in an earlier stage or have no dementia. You can just at any time tear this up. So you need to, the requirements for creating one are fairly high. The requirements for getting rid of it are very low. So you can always get rid of it, but it's harder to create it once you've gotten to a point where you're no longer able to make those well-reasoned choices. The medical power of attorney, or as it's known some places as the durable power of attorney, is probably the most important of the advance directive documents that you can complete. And this is where you are naming an individual to make your health care decision when you are no longer able to. Unlike the directive or the living will, this does not require you to have a terminal illness or an irreversible condition. You just simply need to lack competency. So if you're in a car accident and you're unconscious, or you just fall and you faint, this comes into play. So it doesn't have to wait to the end of life. This is just when you are no longer in a position to be able to make your own choices. And there are limits to what this surrogate decision maker can do. In the state of Texas, a decision maker cannot terminate a pregnancy, cannot give consent for electroshock therapy, and cannot give consent for voluntary mental illness commitment. So this is not somebody who has full control and capacity over your decision making. There are limits that are set into law, and every state has some sort of restrictions that are in place. This person does get to see all your private health information. So under HIPAA, this person is you. They get to see your medical records. They get to get your information. They get to make your decisions. So you don't have to worry about whether they will have all the information necessary to make a good choice. You do want to be wise in who you choose. Choose somebody who will follow your decisions and will honor what you would wish. In Texas and several states, if you do not name a power of attorney, the law actually decides for you. And there's sort of a hierarchy of who makes the decisions. So first person would be your spouse. Then it would be your reasonably available adult children, your parents, your nearest living relative. And if none of these exist and there is no legal guardian, then for most decisions, a clergy member can make the choice, or two physicians. Or if we're talking about life-sustaining treatment, respirators, ventilators, resuscitation, then clergy actually is not on the list, but two physicians are. So if you want your state to decide for you, it's probably in the law. It is in many states, but not all. If you would like to decide for yourself, then you really need to complete the medical or durable power of attorney. The out-of-hospital do not resuscitate order is the only document that will be followed if emergency medical services or ambulance or 911 are called. And this is the only thing that will tell them to stop or to not initiate resuscitation. So they will look for this document when they enter a house. Make it someplace obvious. If you have a terminal illness or irreversible condition, you may want to have it pinned in a plastic Ziploc bag above the head of your bed, or even on your front door. EMS will tell you that's kind of the places they will look. Many hospice organizations will suggest you keep it on a refrigerator. EMS doesn't always look at the refrigerator because they're going towards you. So think about the places that would be obvious for them to have it. You usually do need to have a terminal illness or irreversible condition in order to have a doctor sign an out-of-hospital do not resuscitate order. If you have this document, if you do not have this document, but you have an advance directive, EMS still must initiate resuscitation. So it is this document and this document only that will prevent that from happening if somebody should call 911. If you do have that terminal illness or irreversible condition, you should have the conversation with your family to not call 911. Have the number of a hospice, have the number of the coroner or a clergy member nearby to call to help you when the final time comes. But people do panic, and we're all very trained from a very early age to call 911. So having this document is sort of another level of the advanced care planning to make sure that your wishes are honored. In some states, Texas does allow it, you can order a bracelet or a pendant which will give information to EMS that you might have an out-of-hospital DNR. I recommend the pendant over the bracelet because when EMS comes in, they're going to throw you wide like this, and they're going to see a pendant on your neck, but they're not necessarily going to see a bracelet because that's not what they're looking. And this document must be signed by a physician and a witness. In some states, it will also require a notary, but not in Texas. So this is another piece to think about. So, in summary, in advanced care planning, you want to let your friends and family know your end-of-life wishes. You want to document those wishes and take steps to think about the end of your life so that your family doesn't get burdened with that when your time does come. And so think about this as a gift to your family and your friends. Thank you very much for your time. I'm Dr. Craig Klugman, and happy advanced care planning.